Hello. We're going to talk about lavage and gavage today. So if you have a baby that's been really spitty, gurgly, throwing up a lot, your provider might want you to lavage and or gavage your baby to try to clean out their stomach. If that's the case, we need to make sure that we verify our order. We gather our supplies. We want to make sure that we have our either 5 or 8 French kangaroo feeding tube, that we have our purple syringe that matches it, purple and purple, color-coded. We want to make sure that we have some sterile water. And if the provider wants us to gavage, to put down some formula, we need to make sure we have our formula ready as well. You can have a little medicine cup or a regular cup to pour your sterile water in to make sure that you have lubrication and to clean out the stomach. So we're going to use our water. We're going to get our baby. We're going to educate our patient's family on what we're going to do. We're going to get our baby. We're going to, a lot of times, have a helper with us just to help hold baby and hold our tube. We're going to swaddle our baby good. We are going to, let me get that baby ready. We're going to swaddle in a way that we still have our chest open so that we can do our measurements. So we're going to kind of tuck under the arm and kind of then fold down across baby's waist. And then we're going to go down over this arm and then kind of fold across baby's waist. And then that way their little arms are secure. You can have somebody help hold. A lot of times you can tilt your baby up like this. It just kind of puts the baby at a better angle. We're going to do a full set of vital signs on our baby, make sure that there's no distress, respiratory rate is good, heart rate is good before we start. And then we're going to wash our hands, put our gloves on. We are going to get our feeding tube. And we're going to measure. So to do an OG tube, we're going to measure from the side of the lip to the earlobe, halfway between the xiphoid process and the umbilicus, right here, which is about 20. Then we're going to go ahead and get our syringe connected to the end of our tube. And we want to check placement with about 1 to 3 mLs of air. So you can go ahead and pull up your 1 to 3 of air. Get your syringe connected here so you're ready to go. You can use a little bit of that sterile water to lubricate that tube. And you want to kind of use the tube, place the tube where it's kind of wanting to already go kind of down and backwards. You don't want to go this way where it's wanting to go up. So you're going to turn it, make sure it wants to go down. You're going to just kind of support the baby and kind of pinch the cheeks a little bit. You're going to go straight back. I'm sorry, baby, I know this is rough. You're going to keep going all the way straight down until you get to your 20, to your mark. Then you're going to kind of hold it right here at the side of the baby's cheek. You can have your stethoscope on. You're going to listen right here at the tummy. You're going to push your 1 to 3 of air. You're going to hear that swoosh. You know that your placement is good. If we're going to do a long-term OG tube or NG tube, we want to make sure and get an x-ray. But just for this quick cleaning out, we're okay just doing that 1 to 3 of air to make sure we hear it over the stomach. Now, once we've got that air in, we know we're in the right spot, we're going to start pulling back. We're going to see if we're getting air, gastric, what we're getting out of that tummy. You can keep pulling back until you feel resistance. Once you feel resistance, you want to stop. So we're going to say I'm getting 9 of air. So I'm going to get rid of that. It's just air, so we can just squirt that out. We're going to try one more time, make sure that we don't have any more air or any other gastric. If we get some yucky gastric, we're going to say we get 5 of yellow-green gastric. You can have a second cup here ready to squirt that in so that you can measure it and document it later. Or you can boo it in your sink. Now, if you have an order to clean out with 10 mLs of sterile water, you can draw up your 10 mLs of sterile water from your sterile cup that you poured earlier. You're going to reattach, and you're just going to really slowly push this 10 mLs into that kiddo's stomach. It's real slow. Sometimes you can then kind of turn them to the side a little bit, push a little bit more, go to the other side. And if your helper's here, they're going to be able to help you position this baby a little bit better. A little bit more. Once you get that 10 mLs in, you can just kind of massage the tummy area, kind of turn them side to side again, kind of help wash that tummy out. Whatever you put in, you want to make sure you get back out. So if we put 10 mLs in, we want to make sure and slowly pull back and that we get our 10 mLs back. Sometimes you're going to get a little extra than that. You'll get some additional gastric fluid, but we want to for sure make sure we get our 10 back. So we've gotten our 10. We can get rid of that. At this point, if that's all the physician wants you to do, you can take your tube out and be done. If they would like you to gavage some formula, the order should say exactly how much, 5, 7, 10 mLs. If that's the case, you can take your syringe and you can draw up your, we're going to say 5 mLs of formula. Reattach again. You can slowly push that in, or what you can do is you can also pull out your plunger and you can let that go via gravity. So we're going to let that go, that 5 mLs of formula go in via gravity. Once that's done, we're going to take our syringe off and get rid of that. We're going to cap our tube. And then we're just
capping again, please.
Right here, this just goes right on here and screws on. Once you've capped your tube, then it's just going to be one swift motion of pulling that tube out. And then you can discard this. We want to make sure that we document exactly what we put in, what we got out, what it looked like, how the baby tolerated it, if we gavaged with any formula, how much, and how the baby tolerated that as well.
And why do you cap before you pull?
You want to make sure that we don't allow air to go back down into the stomach, that we just took all of that out. So we want to make sure and cap that, so as we're pulling it out and it's sitting there, we don't allow air back in.